Thank you for watching In Focus here on PHL17. I'm Jennifer Lewis Hall. Well, today on In Focus, we take a look at the impact of COVID-19 on the African American community. And we hear about a Pennsylvania caucus hearing that's focusing on COVID-19 and maternal health, as well as health disparities. That's all straight ahead on In Focus. But we begin with a look at the toll that COVID is now taking in the area of life expectancy in the region and across the United States. And the numbers, they are staggering. The U.S. Centers for Disease Control and Prevention recently saying that life expectancy dropped 1 year during the first half of 2020 to its lowest level in 15 years. Now, life expectancy for African Americans and Latinos was even lower during the first half of the pandemic. Joining us to talk about this is Dr. Renee Bullock-Palmer, who is a locally based cardiologist and the Women's Heart Center Director at Deborah Heart and Lung Center. Thank you for joining us.
And thank you for the invitation, Jennifer. Great to be here.
Such important things to discuss. I wanted to get your thoughts after just hearing about this report.
Yes. So, the data that was presented was very sobering. As you had mentioned, the drop in life expectancy on average was 1 year. But when you looked at the data and teased it out in terms of ethnicity, you saw that African Americans fared the worst. The drop was almost close to 3 years, 2.7 years which was quite stark. And for Hispanics, 1.9 years. So it's a very sobering piece of information.
It really is, and something that we have to continue to address before it gets even worse. Now, doctor, so many people are grieving the loss of loved ones due to COVID, and earlier this week in Washington, D.C., flags were lowered to half staff, and this was as we saw the president and vice president attend that memorial for the more than 500,000 Americans who have lost their lives to COVID. And of course, so many people thinking about this, and you used the word sobering, we've heard staggering, but we know that each and every one of those individuals are husbands, wives, neighbors, friends, sons, and daughters. How has it been talking with your patients and no doubt certainly families that you've interacted with who have actually lost a loved one?
Well, I can tell you, I've had many patients who are concerned, but there are a few of my patients who have actually lost their own family members. I've had one female in particular. She lost at least 2 or 3 of her family members over the course of 6 months. And it's devastating. It's life-shattering, life-altering. And for these patients, we really have to help them both mentally as well. Of course, we are a heart and lung center, but there's always that mental piece that is oftentimes forgotten. And that toll weighs heavily on the heart because there's that mind-body connection as well.
Absolutely. And I want to go into now a little bit more of the numbers. You mentioned them off the top as well as I did. And we were talking about that life expectancy during the first half of 2020 dropping by 1 year. That's the total number in the United States, mentioning 77.8 years would be the age now. And life expectancy for African Americans declining, as you said, the most. Black Americans losing nearly 3 years to 72 years of age. Latinos losing nearly 2, according to those estimates. Why is this happening? What can be done?
So there are 3 main reasons why this has happened. And, it's a compounding effect, this pandemic on top of all of the disparities that we had before. But the 3 main effects are, one, many minorities are on the front lines. They are exposed to the virus some more than others. They do not have the ability to work from home online on Zoom calls, right? So they have to be out there not only as healthcare workers, they're also in retail, delivering our food, delivering our groceries. They're cleaning our streets, operating our buses and trains, especially in large cities. The second thing is living conditions. So a lot of minorities, African Americans, Hispanics live in multi-generational homes, overcrowding living facilities, may not have the ability to socially distance as they would like to. So of course you may have your grandmother, grandpa living with the grandchildren. Grandchildren are going into school, or the younger daughter, son going into having to work, and it's very difficult. Now the third, and what I think is a major reason for this disparity in life expectancy, is that unfortunately unfortunately, in many minority populations, we've had a huge burden in chronic illnesses such as heart disease, lung disease, diabetes, hypertension. So we've had that burden, and now compounded on that, we've had the pandemic on top of all of those disparities, and all of that coming together, I believe, is what has resulted in this very stark data that we have seen.
And so what can be done? And then the second part of that, if you can quickly, is many talking about this actually highlights disparities in healthcare.
Right. So I think this hopefully will be a wake-up call for many. It's going to take teamwork, not only for healthcare providers on the front lines taking care of patients, but health policy as well. Trying to also, help to especially these minority populations, to not only help to lift them out of poverty through, having them providing economic advantages for these individuals. And I think, we really have to have a wholehearted approach to dealing with this disparity. Another major issue, I think, is the deep-seated distrust that many minorities have with the healthcare field, and that has dated way back to many years where research actually was of disadvantage to minority populations. So there's that distrust. So each time I see my patients, I always these days in the last 2 months, I've always raised the discussion about vaccinations. It's absolutely important. Trying to address their hesitancy, their concerns, and it's really going to take a wholehearted approach, not only provider-related, but policy-related, and also giving financial and economic support and education as well.
And you talked about, you believe in getting the COVID-19 vaccine from what you're telling us, and you're saying you're talking with your patients about that. That was something I certainly wanted to highlight and talk about here with you as well. Dr. Bullock-Palmer, thank you so much for joining us. We appreciate your time.
And thanks for the invitation.